So we very much welcome you here, and perhaps you'd like to make a statement to start with, and we'd like to welcome your observers as well.
So shall I just say
what you want to say?
There are a few points I've been asked to raise on behalf of patients. One of them is, when pelvic mesh is inserted, it's usually intended to reinforce tissue. In many specialities, including urological, gastrointestinal and gynecological, once mesh has adhered to organs, blood vessels and nerves, etc., a new speciality has been created. This new speciality is trauma. In the opinion of one of our professional members who owned her own clinic before she was disabled herself by mesh, surgeons such as those trained in war zone frontline pelvic shrapnel injuries should be employed for mesh trauma injuries. Gynecologists are not trained for this. Qualifications and experience can be supplied upon request. So the next issue is about claims, financial claims. Many patients are signed up by solicitors and often dropped due to time constraints laid down in law. Many are time barred from any future compensation claims. All mesh injured patients need the limitation in period interrupted, giving an unequivocal reservation of rights to enable them to claim at any point in the future. The next point is about care packages. Care packages are needed right now for mesh injured patients. That includes adequate financial assistance and ample fuel payments, especially before the winter sets in. The cold is coming and they feel it terribly. The next issue is mesh removal waiting times and partial removals. I really don't understand why patients are having to wait so long to get mesh removed while they're going back and forth to hospitals for appointments and different types of treatment. And I'll give you an example with something like, if I got a saucepan stuck on my head and went to the hospital, they wouldn't take half off this week and the rest off in 6 months. They would take the whole thing off. And I really don't understand why these patients are being turned away from hospitals and nothing is being done to help them. And partial removals as well. I don't understand why a patient has to go in and have part of it removed and then go back and get the rest of it later. It just seems like it's adding more risk and more injury to the patient. The next issue I'd like to mention is MHRA engagement. There doesn't appear to be any with the general public. Most people don't even know who the MHRA is. In America, most people know who the FDA is, but here they don't. I've talked about the MHRA for years because I've been in industry for the past 18 years. And when I talk to people, they say, who are they? And I don't find that the MHRA is engaging as they should with the general public. The next issue is, I think there should be a mainstream media announcement for everybody who may have been affected by mesh, because at the moment people who use the internet are being made aware of mesh, or they're being made aware of mesh by people talking to each other. But there are also other people, older people, who live in care homes, and their carers are wondering what they can do with them, how they can treat them. They have no clue, and these older people don't even know that they've got mesh inside them, or what's happened to them. People really don't know how to care for these people, and there are people just still wondering, how did I get into this mess? The next issue I'd like to raise is post-mesh removal. I think that many patients are being told that they're having a full mesh removal, but later on they discover they still have issues, and they go for a scan and they find out that they haven't had a full removal of the mesh. I think that it's important that these patients are offered scans post-mesh removal to reassure them that all the mesh has in fact been removed as far as possible. Because as we already know, if you look at mesh under a microscope, there are very fine hairs coming off them. These are sort of filaments, and once it's put inside the body, these break off and they travel everywhere. So it's not actually possible to do a full removal, but it's possible to do a full removal in the area where the mesh was found. So an independent scan, I think, should be recommended for these patients. I would also like to suggest that a material analysis is done on every piece of mesh that is removed from patients. Because at the moment, most manufacturers don't know what materials they're using, and that I find highly shocking. I really do. I've often asked manufacturers to verify what materials they're using, and they can't. I've rung their suppliers, they don't know. I've rung their suppliers in China, they don't know either. And they've even said to me, I'm the first person who's ever asked this question, and they didn't know why I was even asking the question.
Can I interrupt you? Do you mind?
Yes, of course.
Because I know you know about these things. But I thought that they now only use monofilament macropore mesh. So do they not know that's what they're using and that it's made of polypropylene?
I've worked with a mesh, not a mesh manufacturer, implant manufacturers, where they've told me the material is this, but they can't prove it. So I've rung the supplier and they've said, why am I asking that question? So I'm saying that if the manufacturer is saying they're using these filaments, can they prove it? Can they verify that's exactly what it is?
What you're saying is that what's in the design dossier, do they actually match?
Exactly, yeah.
Against the
Yeah. Any responsible manufacturer will bring a material in, and even if they've ordered, let's say, stainless steel 305, how do they know that's stainless steel 305? And we need to know. So they will take a sample off, they will get it tested, and they will have the traceability as well. So when the auditor comes in and they say, what material is this? Stainless steel 305, how do you know? There's my evidence. Yeah? And it's very important as well for the environment, because manufacturers should be responsible for their materials until disposal as well. And if they don't know what materials they're dealing with, how can they be responsible for that? And the material analysis post-removal will also help determine what problems the patient may have in the future. It may help with many patients who've had that type of mesh, if we can prove that those people had that exact batch of mesh. And then you might also find that you have a set of patients who once said they had, let's say, proline mesh, they had proline, but all of a sudden you have a different type of material. So you're going to have a different type of symptoms, different types of treatment that these patients need. The next issue I'd like to raise is paperwork. I believe that patients should get a set of paperwork not only after they come out of hospital, but before they go in. So everything is agreed before they go in. So like if you took your car for an MOT, you agree the work that's going to be done, and you get a receipt for what's going to be done. And when you come out, you get a receipt for exactly what has been done, and you can put the two together, and that's your record. And you get one for a car, and you should get one for your own bodywork as well. The next issue I'd like to raise is adverse event reporting. I don't believe there's anything wrong with the adverse event reporting system. Surgeons do report, doctors do report, users report, and it all seems to work. And when there's a problem with the device, it's put right by the manufacturers. It's the way the system works. Surgeons aren't reporting that mesh is faulty because they don't believe it is. They should be able to rely on the CE mark device as being safe and effective, and they send their patient away, and according to them, that they think that the mesh has been fine. So The adverse event reporting is applied when a surgeon perhaps has a catheter in the brain during surgery and that catheter splinters. Then the surgeon will use the adverse event reporting system. Yeah? Or if someone in a hospital puts somebody in a wheelchair and the wheelchair broke, they use the adverse event reporting system. Now, for a surgeon to report surgical mesh as faulty, it would have to break during surgery. So maybe he took it out of the packet, it wasn't sterile, or the plastic had split already. That surgeon would use the adverse event reporting system. So there is no gap there. These devices aren't supposed to fail. The next issue I'd like to raise, I think this is the final issue, is about manufacturers, surgeons, systems, quality and trade. In general, in the UK, in the manufacturing industry, manufacturers are not happy. In fact, they're quite angry with the UK's MHRA and their designates. Surgeons should be able to rely on safe and effective devices every single time. And they should be able to know that if they come across a faulty device, it will be put right and it will never happen again. That's what our quality management systems are for. The last issue I'd like to raise is quality and trade. Trade depends on quality. And thank you for listening.
Thanks very much indeed. It's very useful. Candia, is there anything you would like to add or say now? Or?
Well, we actually met with the MHRA and we were well received. We had a 3-hour meeting, didn't we? And I had this question about how the charity can work with people, because I think that, you know, we need to all communicate, and it's quite frankly, it's all been fractured. Nobody's talking to anybody, and it surprised me. But like I said, we were well received. One thing I asked, which I thought was very pertinent, considering my own personal situation, the MHRA, are they considering the cost and the impact to the government, for example, for allowing these medical devices? They said you need to talk to DOH, Department of Health. And I thought, oh my God, another meeting, seriously, you know, it's just too much, you know. But to just encapsulate a part of it, and I tried to do it on my statement, literally I ran out of time, and I had to submit it, but, and we had an extension, and it was still, I just couldn't write enough, it's too traumatic. In following my surgery, I had 7 years where I found myself on benefits, okay. I had carers. I had carers of, I think it was 21.75 hours a week, a godsend. I couldn't be a mum without those carers. But it forced me and my husband to separate. So that's how come I ended up in the scrap heap, if you like, you know, because that's how it was. It's exactly how it was. So when I add my benefits to my care package, and then one stint in hospital for 4 weeks at Leamington Rehab, because I couldn't string a sentence together. I couldn't do it. I had dysarthria severely, I couldn't understand things, couldn't read things, couldn't remember things. I was just a wreck. I understand that one stay was £80,000. And if you look at the care package I had and the benefits that I had in that period, you're talking about $250,000. So now I'm going to tell you a little bit more about my case. So I had a hysterectomy. I was told, I am only going to take your womb, I'm going to leave you with your ovaries, and that's all I'm going to do. He lied. He did 4 additional surgeries. Sorry. 4 additional surgeries, gave me 4 mesh kits, and he's lied every step of the way along the line. We are owed something back, but I'm going to quantify the cost to the government. That's what I'm going to try and keep my focus on. So now quantify this. I've kept every single appointment letter over the time because I didn't know what was wrong with me. I knew these letters were important to me, and I knew they'd tell the story one day and they would help me work it out what happened. I think I've had 362 hospital appointments. This excludes blood tests and GP appointments in the last 10 years. Hospital visits. I don't know how much they cost, £100 a pop? I don't know, £150 a pop? Medications. I've had 75 different types of medications for pain, infections, everything for the last 10 years. But remember, I didn't know I had mesh. I didn't know anything about it. So I am empirical data. I have all my evidence. I've kept everything. I've done my findings. I've found, and I offered them to the review team to use my case as an exhibit to what is happening in mesh. I don't have a choice. I have to expose my story. But I'd rather it be used in a correct way, that lessons do get learned. Because I did find myself as empirical data, and that means empirical evidence. When you've got a pure test subject that had been treated to extra mesh, extra surgeries she didn't know about or she never consented to, and she has this much harm and it's cost the government this much money on one section of my care, excluding my appointments. Out of that, I've had 65 MRIs, scans, and nobody told me once about the mesh. Nobody told me that the scars on the front of my pubic bone suggest that I've had bladder surgery. I mean, seriously, the scars were there. They're ancient scars now, but they tell a terrible tale. My story gets worse. I wish it didn't. I wish it didn't happen to me. But anyway, I went around the world. I don't know if you've all read my statement. I went to Finland to get the truth. To my implanting surgeon, I asked him, what did you do to me? You need to tell me what you did. I was calm, I was polite, and I recorded my appointments for the last 3.5 years because something was not right. Something was really not right. He told me he didn't do anything to me. I know he's scared, but I gave him the opportunity. I flew there with a translator in the event that he forgets his English, even though it's still proceeded to tell me this. I then went to the US. I flew to 2 mesh removal surgeons. And in each one of those times, I've let them treat me how they treat other patients. I've recorded. I've put myself in a terrible situation in a way. I've let them examine me. I've let them trim bits. I've had so many biopsies. I have lost count. It's ridiculous. The whole thing is ridiculous. But it does show exactly what is going on for patients. I've never been rude. I'm not rude. I needed the help. Patients, this is how it is for patients. Even if you're treated badly by a surgeon or doctor, you swallow every pill, you do everything they tell you to do, because if you don't, you will never get the help. And what do you want when something's wrong? You want the help. You have to do as you're told. So I've done it all. So out of all of this, it's cost me 40,000 in the last year or thereabouts, travelling around here, there and everywhere, undergoing surgeries, and they don't want to admit to the fact that this mesh is a problem. But there's something more darker than that. You've got problems on your own territory here in this country, and for that I must speak out. And I'll never be able to stop. Because what happened here is, and it is terrible, I'm really sorry, I know she's well respected as a surgeon. I went for mesh removal in 2015. When I woke up to Mr. who was trained by Mr. at that time. And he told me I had no mesh. None at all. I have 4 pieces, and he was telling me that I had nothing wrong. I'm sorry, they lie. Surgeons lie for whatever reason. I don't care, but when you lie to a patient that relies on that information because they're trying to get themselves back on their feet, get back on their work, get on with their life, it is criminal. It's criminal in moral terms, legal terms, every term you can put, humanitarian, every level of wrong. But why lie to protect a friend who did a surgery on me that he shouldn't have done? Why not help me? Why leave me so that it tears through my skin, or it tries to perforate through my stomach, or it tears my toilet tissue as I walk, or I videoed it coming through my rectum? I have disclosed everything to you that I can think of. I've shown you pictures of my vagina where it's all traumatized. I've showed you distortions in my vagina where it's changed form. I think I've sent you the video where it's actually torn through my rectum. I have nothing to lose but to show you with you everything. I urge you, if you haven't seen it, it's still on the light. I haven't pulled it down. I haven't pulled restrictions or anything like that. I want you to read that statement again and again and again, because I'm offering it to you as evidence, empirical data to prove that if arguably for 1 second in your mind you felt that, oh well, it's her own silly fault, she went for that operation, she had the chance to do research or something like that. I didn't. And at the time I looked at the NHS research to see what the hysterectomy will do, there was nothing on there about any mesh at all. So in no way did I know that they would do additional surgery, bladder surgery, colorectal surgery. Doesn't it sound crazy to you that someone like me can actually work it out for, I mean, it must be crossing your mind. How did she work it out for herself? How does she track it out? She's got no medical knowledge. She was like literally bedbound, dying, vulnerable. Stretchered out there she was dying. This me, I know it's me, I'm talking like it's the third person, but to me it represents everyone. Because even if you consented to this bladder surgery, I'm going to tell you empirically and emphatically is probably the better word, nobody would consent to this. Nobody. Who would consent to, and I did bring some things with me because I just think these are some of the things that you can't make this up. Nobody can exaggerate this. No, nobody at all. Plastic bits coming out of your vagina. Why would you have plastic bits coming out of your vagina? They're sharp, they're shard-like, they feel like really gritty. One of them in particular, the bladder one, this is how it makes me feel when I'm sitting here. I feel like I'm sat with that inside of my vaginal area around my bladder, cutting through my urethra. Yeah? Who would want that in their body? Watch. I'll pass it around if you like. But you can see, like, on one of them, they just split, and they're very sharp. They're the ones that, you know, when you get your parcel tape. And they are sharp. That's how it feels like, just sat there, just on the inside of the pelvic area. I couldn't manufacture this. Those 342 appointments, or 362 appointments, didn't happen because there's nothing wrong. I feel like it's impossible to explain, but I can explain this. Here's some Stanley blades. Yeah? When after my surgery, she said there was nothing wrong. I went and I got my surgical notes about a year later afterwards, and it showed that I had 4 mesh kits implanted. When I was being examined, they're putting their hands into the vagina area, and I guess they're shifting the colon out of the way, and they're feeling the part of my spine. As they're doing it, it felt like against my spine, that sharp. Yeah? And I don't think they know what they're doing. I honestly do not think that any of these guys realise how bad this stuff is. I genuinely think that they probably got a cure, but they don't. There's no way anyone would consent to that, would they? All that. All the fact that you lose your sex life, all the fact that you can't be a mum anymore, or that you're going to need carers. Who would consent to that? And death is a risk of this surgery. I know that you know, I'm sure there's a few people that have died. She had 1 mesh, I have 4. She's the same age as me, but I've never been able to be a mum. Recently, we lost my and I had an amazing bond with him because I got told I didn't have mesh, I took him in. Terrible thing, but as a woman, you want to look after your family as long as you can, you know? I couldn't do it, I was on my knees. I got told I hadn't got mesh, I thought I could take him in, I thought I could look after him, but I couldn't. I couldn't because he, you know, when he I couldn't bend down and help him. Our family broke so many times over, but as empirical evidence, use my case, use it to everything. I have nothing to hide. And there's more evidence, there's more recordings. I've been recording these guys in hospital for the last 3.5 years. And the first recording that we ever did, and bearing in mind, I just want to get my health back. I want to get my life back. The whole time, the whole 10 years, that's what I've been doing. Going around the world, everything. And that's what you would do. That's what you'd all do. And quite rightly so. I'm losing it. Sorry. I've lost my thread. It's too much. I've lost my, what was I saying? Sorry.
Come around the world.
Yeah, well, I feel like I'm going around the world in my head. What was I going to say? Oh yeah. Anyway, so he went into home to find out that I've got all these mesh kits. And I could have been helped, but imagine it was hailed a hero. She's not a hero. There's laws in this country that have been broken. There's the Nuremberg Code, duty of candour, that's been in effect, and it happened, duty of candour actually took place in June 2015. I fell under the October. That law was in force. It was already in force. I don't understand. I don't know how somebody of that stature, hailed a hero, can lie to patients, tell them they've got nothing in them for it to tear through their skin. I've actually sent you the video recording of my last ever appointment with her, which was April 2018. I still am her patient on record. I am still her patient. She doesn't want to see me again. She's quite happy to still tell me to this day that, yeah, no. And on it, you'll notice that I asked her for a mesh removal, a point of referral. And you'll see her hanging her head in shame. She knows. I'd like you to ask her about my case. I have no qualms. I've faced her. I've given her the opportunity, like my mesh implanting surgeon, like the mesh removal. These people should be in trust. But who was protecting patients? I understand kickbacks are paid for, blah, 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 but I'm going to tell you something else as well. I also know that since my surgery, although she may have helped me get back on my feet, I'll give her that. I will give her that. She did help me get back on my feet. I nearly died. But what I don't understand is how I had a whole new myriad of symptoms, and I've actually got new lumps like attached to my ribs, and it can be felt in the groin as well and picked up on MRIs, because that's how I found out for sure was last October, which again I've sent the MRIs to you on with my statement that show I have mesh in me. But they're not meshes that are different or anything like that. They can be seen. Out of those 62 MRIs now, I've got most of them, because obviously I've been around the world, to try and get the help. So obviously I've got, and I can see that it's easy to be seen. Scans and MRIs are, to me, not rocket science. Not at all. You can quite clearly see them. It's down to the trained eye, and we've been told a load of lies about the scans and MRIs. What I'd like to propose is that we have at the charity a scanning equipment so that people can come and see for themselves. It might be something that they might be able to do themselves, or we might be able to get a radiographer in time. But I would like to offer that service through the charity and fundraise for that, because I want people to now feel safe and that they've got somebody on their side, not for profit. We could do it for donations or something for the charity, because the charity just does respite breaks. Those respite breaks are essential. They're not much, but they're about family. So going back to family a little bit, I didn't go to the park with my children for 2 years because I didn't know what was wrong. I couldn't walk properly, I couldn't see properly, because it affects everything. There'll be a whole list of symptoms I wish to provide in time through all my diaries, because I was asked to keep a diary following implants, and then I got told off for doing it, so I had to stop it. But I've still got that diary, and I want to put across to you that you will end up with neurological issues, respiratory issues, autoimmune problems from day one, because that's what happened to me. I was very sick, and then also equally very disabled. So picture this, if you will. You're all women for this exercise. And they're going to do they're going to tell you that they're going to do a little mesh to hold your bladder neck up or something. Maybe they'll do a prolapse fix. They'll just say put a bit of mesh at the top of your vagina. They will not tell you that they're going to anchor it to your spine and this wretched stuff's going to go through your bowel. So I've got a piece of mesh. I don't know if you've ever seen mesh yourselves. I'm sure you possibly have. This one's actually hernia mesh, so obviously it's slightly different, but the essence is the same. Nobody wants to give me any vaginal mesh. I don't know why not. But anyway, this was brand new, and on the edges it's serrated and it's very sharp. One side is particularly rough, the other side's not so rough. Nothing says which way up. But the thing is, to have that inside of us, it scratches at our bones. Yeah, you can feel it on your bones. Like I can feel it across my spine here. I shouldn't be able to feel that. We shouldn't. This is madness, absolute madness. How this can happen. But if you put that across, say for example, we're going to stick it from the top of your vaginal vault across to your spine now. Look at those sharp edges that can go across any sort of health you can cause through a bowel. Now, I remember one of my doctors screaming at me saying, "The bowel doesn't feel anything." Oh, it does. Can I share with you something very harrowing? And I don't think I can hold it. Can you play it? Can you sing it? There was two. So this is about, this one can cover a few stories. Okay, first one is lignocaine infusion. So when you have lignocaine infusion, because I've had 75 different types of medicines, I've tried everything, nothing works. Nothing works. Nothing to cure, nothing will help you get through, or anything like that. It just makes you more sicker, okay? But in particular, this lignocaine infusion, which I've been having since 2010, There was some help, but it doesn't solve everything. The other one was a speculum insertion, so it's very routine stuff for women, you know. They put the speculum in, they crank you open, I'm sure you've read my statement, and as it did that, it turned me into mincemeat. That's the only way to describe, and these surgeons ran out on me, left me chomping on gas and air, they couldn't handle it. And I'm going to give you some idea. We'll just play it. Is this, you might want to hear this. Is that in the right place here?
Yeah, just click play.
At the top, is it? Okay. Shut your ears, please. I'm on gas and air at this point. I've had all my medicines. Oh, is this painkiller? This lady didn't know she had mesh. This is reality. I have to show you. At this point, I felt possessed. My back's there. The screams are coming. I promise you, I wanted to die. I wanted to die. I didn't want to live through that. Not again. Too much. But too much because so much pain. But apparently, the bowel doesn't feel. You see, what was happening is I felt my muscles relax right down. The muscles relaxed right down, and something was skewering me from inside. No, I can't fabricate that. I can't, because I didn't know the date of that. Wait, I can't even see because of the crying. September 15. I got told in October I didn't have any mesh. So it's very real. All of this is so, so, so real. The only way to describe pain to you is to feel it, people witness it, hear it. But my legs were up. I was trying to breathe through it. I was literally trying to work with everyone. I was having lignocaine infusions through your veins to help you deal with the pain. So the only way to make people actually really understand mesh pain was to actually play that to you. It's too much. Shouldn't be happening. Should not be happening at all. I'll never be able to endorse this type of surgery for anyone. Not for cancers, not for anything, because if that's the cure, then there's something very wrong. Very, very wrong indeed. And I really hope that the right thing obviously gets done, because if you've got empirical evidence of something, you can explore it a little bit more. The other thing I was going to say is, this is supposed to be well thought of as a cure. You're supposed to inject it into your vagina, and the principle behind that is it helps the skin cover over the mesh that's been exposed. Did you know that? That's disgusting. That's disgusting, because the infections and everything, these ladies aren't lying. They were never lying, they were never malingering. They're not scrap heap, but their literally lives have been turned upside down for what? It's not a cure. It's not a cure, it's toxic. It makes you very, very sick, because that's what happened to me. I felt very, very sick. I felt very, very poisoned, and I couldn't walk properly. So for the first 8 years, until I never reported that my left leg wouldn't go flat to the bed, because I didn't know what was wrong with me, yeah? She also released my left leg. So the first time ever she released my left leg, that means that she took something from my pelvic area to release that left leg, because I didn't even report it to her. I've given you all the transcripts from the appointments, so you'll know verbatim what was said, who said what, by who, and all the rest of it. She did save my life. I'm back on my feet, but I'm very disturbed by everything I've seen, witnessed. I knew instinctively that I can't help anybody, not really, but I can try. I can try by sharing my experiences and teaching people. I am going to propose something in a way that's going to help everybody move forward. I want to do some training with people to help people deal with this. because only I really truly understand how bad this is, and that's what I can do. I can teach people from what I've learned. I can help them. I can provide a scan equipment. Obviously, I know fundraising and all of that, and that's quite challenging. We've also saved 26 people from suicide this year. We've only launched this year. So since Good Friday, when we launched, we've saved 26 people because we understand what's really going on for people. We're already making that difference, but we're new. We're new, but we're very effective. I can't explain why, but I think, you know, staying with us, there's something special about me and a lot of people, okay? There is this thing about the bond between Mesh injured people is so strong, so very strong, because despite everything, we're all joined together in terror, trauma, horribleness. It's so hard to know who to trust. It's really, really hard, especially with your lady area. That's, you know, we're taught that's just for our husbands. And then we have to trust people time and time again. So what happens with me now? Is there any justice? I haven't seen any, actually. I'm going to be honest with you. I want people to take on my case. I want people to use this as an example. I want people to be dragged over the coals for what they've done, whether they've lied or something like that. Absolutely. Absolutely. I'm owed, and so is everyone else. Without a shadow of doubt, everyone's truly owed for this. The compensation will never give back or take away what's happened to me and my family. My youngest daughter, she's 15 now, she's never known a fit and healthy mum. The other two had terrible troubles, even though they were at school, because they saw me as a hero. Then living in Paris, social, going to Galeries Lafayette, drinking champagne with my friends, to not able to do any of those things anymore and needing them to then care for me. And that's why I decided to do a charity to help families, because that's what it means to me. Yeah, I think they should be answered, and I think, you know, people should be paid. I don't think the government should be out of pocket for this. You know, $250,000 for one part of my is what I worked out. I couldn't be bothered after that. It's just too much money. Who's going to take it on? Where do we go? Where's the book that says where we've got to go for this? You know, you ring up solicitors. You know they're looking for something specific to get an angle on. I want that pulled over here for this. He's part of the... Let's see, why not? Make an example of him. He lied to me. I've got him on record. We've got the transcripts. Something's got to happen, because this is just so wrong at every level. But the thing is, since I've done my group, I set up my group, February it was last year, and it's because I know that there's every level of wrong with this. But since doing this, I know now, like like I said, we've saved 26 people. One of those ladies was willing to jump. She's actually on my website. Jump off a bridge. Had the, I don't know, the compunction, if you will, to join a Facebook group to see if there was something out there. She found ours. We saved her life. She was the first. She was given additional surgery too. So she went for a breast op and came out with hernia op. The surgeons lied to her too. Then she found that, and the battle continues. You see, the thing is, if say for example, we thought you've got a medical device in you, okay, it's a problem, okay, we'll take it out, and you're I can't even think what the word is, sorry, hopscotch free or whatever it is, I can't even think, sorry, scot free, you're scot free, they'll take it out, you can't know. People are losing organs for this.
Candia, can I just say, I mean, what you've been through is so ghastly, just so ghastly. And I think your courage to keep going is really awesome. I think it's amazing how you managed to do that. And your presentation to us today, I'm sure, has left us all with really an awful lot to think about. And it was, certainly we shan't ever forget it. And I do want to thank you for coming to tell us all about that. And I would also like to thank Joanne as well, because I know you've done a lot of research on all this. And both your personal testimonies are really important to us. And I want to thank you so much for coming, and for your husband here, and thank you as well for coming to support you two remarkable women. So I'm afraid we've got to draw this to a close, and you've had the most horrendous day. And I think to come here and tell us as you have has been just amazing. So I want to thank you very much.
Thank you.
Thank you very much.